What brought you to the field of play therapy, and how did you begin your training?
I was a child protective services worker in East Texas, and I was a foster care worker. So all of the kids in my caseload went to something called play therapy, and it's the first time I had ever heard of it. And it was exciting because I could see that the kids were really getting better, and I knew, of course, there were multiple reasons. They were in a foster home and getting loving and caring, but I was just so intrigued by the play therapist notes that I would get every month about their therapy, and I just got so intrigued. So I went to a conference for child protective services worker, and there was somebody there giving a presentation on play therapy. So I went, and I got hooked. And it was really exciting. So at that time I lived in East Texas, and University of North Texas was the nearest place that had any coursework. So I tried to figure out how could I start that doctoral program and commute back and forth, which wasn't a viable option. And then it turned out my husband and I moved to Denton. And so I was still working with Child Protective Services when I took my first play therapy class, and was able to integrate a lot of that into interviewing young children about abuse. By then I was an investigation worker, and I just kept getting more and more intrigued, and so I quit my job and became a doc student and studied at UNT.
How do you perceive the current state of play therapy?
Well, I think it's really, really healthy. Over the years that I've been involved in play therapy, I've really seen it grow, not only here in the States, but definitely internationally. So lots and lots of growth of play therapy, and lots of different kinds and different applications, certainly internationally very much with different cultures. I also think our real push on research has finally started to pay off, and that we're seeing better research being done and more research being done. And even now, we're hoping, like in the next short future, that some of the research will actually help some of the approaches to play therapy show up on evidence-based sites, so that we will actually have evidence-based protocols and information, so that play therapists can actually say we're now evidence-based. So that's really exciting to me, to finally be right at that tipping point where I think not just empirically based, but real evidence-based work being ready to be done.
What suggestions do you have for the play therapist of 2020, 2025, or 2030?
It sounds like a long ways away, but I know it's just around the corner. So I would say, first of all, that play therapists need to be very well grounded in an approach to play therapy. I think integrated play therapy is definitely what's happening now, and is going to have a lot more growth. So using lots of different kind of techniques, different approaches, and different ways of working with different kids with different diagnoses. But what I see as I'm traveling and doing a lot of speaking is a lot of play therapists are not well grounded in a theory to really be able to tell you what they believe about why a child is having problems, what happened in their development to have this occur, what has to happen, what's the change agent that needs to happen for the kids to get back on track developmentally. And that really concerns me. So I think that what I would say is be well grounded. And then the whole brain research has just, I think, really impacted our field. And so really understanding how the brain works and what we're doing with kids in the playroom or sand tray rooms or other kinds of experiential activities, and how that, and for us to really understand that, and how that builds then into the kind of play therapy work that we're doing.
You referred to integrative play therapy. How would you define integrative play therapy?
Integrative play therapy. I believe integrative play therapy it's multifaceted. It's really knowing and having clear perspective of child development and attachment and bonding issues, so that you understand the child, that you understand what needs to happen for this child to get healthy again, from dysfunction to function, and to know what the research says about different disorders and different issues that a child might be having, and what are the best ways to interact with that child, to help that child get healthy as soon as possible. I'm moving much more family focused, so family therapy focused. So I think we're going to see more of that in the future too, with really integrating the family and doing much more family work, so that we're really connecting the child in the environment that they're in and how the parents can really interact, and the parents understanding the role that they have to play in both the child getting healthy and maybe the role that they played, without blaming, on some of the dynamics that contribute to the child not functioning as well as they might. So it really is, to me, it's integrated because it's pulling together lots of areas that we now know so much more about, and putting together a way of being with a child that's in that particular child's best interest.
What do you imagine will be a major focus for the field of play therapy in the next 15 years?
Oh, I wish I had a crystal ball on that. Looking towards answering that question, I look back in the short range history, and we get in the field different kind of buzzwords, kind of like, first it was like working with sexually abused kids, and then it was working with ADHD kids, and now it's trauma focused. And so what's next, I'm not really sure. I wish I did, because then I could be out there on the front doing it already. But I do really believe it's the neuropsych information that we have. For example, with trauma focused, we're learning from the brain folks that the best way to work with trauma is experiential kinds of techniques, be they like play therapy or art therapy or other kinds of expressive therapies. And so almost in a backward way, play therapy is getting more elevated with what is needed to help these kids or adults work through their trauma in things like play therapy and sand tray therapy and the tactile quality of all of that. And so I think we're going to see more and more in that in the future. I also think right now trauma-focused therapy is a huge umbrella term, with everything from developmental trauma to natural disasters. And I think what we will see in the future is breaking that into components to be more focused in the treatment, because treating a child with developmental, or even a young person that has developmental trauma that was never treated, and doing something like hurricanes and earthquakes and fires, we're going to learn more about how to be more specific on how to treat those. So I think we'll see in the future that compartmentalizing or understanding and breaking down the whole big field of trauma-focused work.
How would you compare the first 5 years of your career as a play therapist to the last 5 years of your work?
The first 5 years, it was like I devoured play therapy. It was like I couldn't read enough, I couldn't study enough, I couldn't get enough clients. So I was in my doctoral program, so I was a doc student, absorbing all of that and then applying it to kids, and being with lots of kids. I started my first private practice then too, and so it was just all of that wonderful delight of like, it's magic and it works. And so my academic work was really informing my clinical work. And now here, about 20 years later, now that I'm a professor and I still have a small practice on the side, it's almost like it's reversed. It's like my clinical work now and the history of my clinical work is informing how I'm teaching. So it's in the clinical work and what kids are teaching me in the playroom is now informing my academic work. And when I'm teaching and speaking around, I love having the real life experiences to talk about and use as illustrations when I'm talking. And before it was like I'd be in the playroom and I go, oh, that's what that means in that book. You know, so it's just like almost a total reversal. And the process is sort of cyclical and been very interesting.
How do you respond to your colleagues about just playing with children in a play therapy approach?
Oh, this is fun, because when I first started teaching, in my department we have a wide variety of programs, and so one of them is higher education. And so one day when I was playing with my puppets and blowing on this like train horn, a colleague who shared the wall, my wall and his office were the same, and he came over and he was just appalled that I was sitting in my office doing that. You know, I tell people that I learned a second language, that I'm bilingual, and I know play language. And so just as the words that we use are just symbols for like a chair or a house or whatever, that children use play symbolically to describe those same kinds of things. So I just say I learned play language, and it's children communicate through their toys, and that's their language, and that's one of the languages I learn. So when I teach play therapy at the university, I talk to my students about it's going to seem awkward, because if you were to learn French or Spanish, then you're going to feel awkward using and carrying on a conversation initially. But once you learn the language of play, then it just seems very natural and very easy to communicate with children.
What metaphor would you use to define the field of play therapy over the last 15, 20, or 30 years?
You know, here in Texas, we love our wildflowers. And it occurred to me that many of our wildflowers just don't reseed, but they actually, they call it naturalizing. So there's like 4 or 5 to start with, and then the next season there's 7 or 8, and then pretty soon there's just fields of flowers. And I think that's kind of how it's happened. And then I think people come and they dig some up and they take them home with them, and then that process starts again all over where they are. And so you get then variations from the flowers, because just like good wine grapes, it depends on what kind of soil they're being grown in, and so you get adaptations in different places, in different countries, but you have this great spreading, ever-spreading fields as far as you can see of wonderful wildflowers. And I just see that, how play therapy, people get intrigued with it. I see my students who never would have even considered doing play therapy. There's a course they have to take where we intro play therapy, and it's like light bulbs go on, and it's like, oh, that's what I want to do. And they didn't even know kind of that it existed. And so I think it just keeps spreading in that kind of way.
What do you wish you had known when you started on your journey as a play therapist?
I just think it's just how wonderful and what a privilege it is to be so involved in the lives of children. I just think I get choked up because, you know, here I have this little 3-year-old in my playroom, and they just play themselves out, and they work through the issues, they work through their sexual abuse, they work through their distorted cognitions. You know, I could use all kinds of clinical terms, but I'm part of that, helping children get healthy. And I don't know what could be better than that. Okay, the other thing is, just personally and professionally, but just being involved in the play therapy field with the chance to know a lot of other play therapists, to be involved in conferences, to work on boards, to volunteer in the whole area of play therapy has just really, really enriched my life. And and I really wish that every play therapist would have that view now of not knowing what might come, but just of the riches that they could have if they get really involved in promoting play therapy and doing play therapy and enjoying it.